I'm Dr. Rick Greene from the medical school class of 1970, and it's really my pleasure to moderate this series honoring our emeritus professors here at the university. And it's especially pleasurable to talk today to Dr. Frederic Berry from the Department of Anesthesia, Department of Pediatrics, and certainly a faculty member that I remember very well from my days here at the university. So Dr. Berry, Fritz, thank you for being with us.
Oh, thank you. It's a pleasure to be here.
So let me start off. You grew up here, sort of in the medical
Yes,
center.
yes.
You know all about the medical school, the medical center. What kept you here? You could have probably gone a number of places. What kept you in Charlottesville?
Well, I started to be a Navy fighter pilot. I grew up at the Naval Academy, and then my dad got transferred to Norfolk, and we were living there when it came time to go to college. He had, in World War II, been in the Navy with the fleet that led the way for retaking all of the groundwork there. And so I was going to be a Navy fighter pilot regardless. Well, in my junior year of high school, I was a year young when I started school, and I finally hit my growth spurt, and lo and behold, I was about half size for all the people, which meant they moved me back further in that room. And the further back I moved, the less I could read the board. So I told my parents, and they said, well, let's go. Went down and had an eye exam, and I got these glasses, and I've never taken them off.
I understand. So maybe not going the way of a Navy fighter pilot was our benefit.
Yeah. Well, that's right. Then I was trying to figure out what to do, and my dad, even though I wanted to go to be in the Navy for a long time, he stayed out of it. Even by that time, he was a retired captain. And my parents, my mother, I said, you know, I'm having a hard time deciding. I don't think I want to be a lawyer, but I'm not sure. She said, well, maybe you ought to think about being a doctor, because you seem to get along well with people. I said, well, all right, let me see how that's going to work out. So I still wasn't quite sure, and I applied to UVA at the time, living in Norfolk. And my dad said, well, you know, there are 4 brothers and sisters here, and you're number 2. We got 3 and 4 coming. And you can go to any school you want as long as it's in Virginia. And so pre-med, that sort of reduced the number of schools to 1, UVA. So I applied and I got in.
What was your passion as an undergraduate? What did you like doing, and what did you major in?
Yeah. Well, that's interesting. What did I major in? Well, I tried to major in pre-med. They don't have a pre-med major.
Right.
And so they said, well, you'll have to pick one. And I said, okay, I like history. Oh, so I became a history major with all of 2 courses in history. I was a history major. But I played lacrosse and was on the swim team, so I had very active, and I was in a glee club and was one of the original Virginia gentlemen. So I had a very active life in college, and fortunately had good enough grades to get in med school.
That is wonderful. So you were a well-rounded undergraduate.
So I got in after 3 years and went to med school. And then when I was in med school, everybody, if you remember, keeps asking you, well, what are you going to do? Well, the first 2 years, I had no idea. And come my 3rd year of school, I'm thinking, well, I'm not sure. I don't know if I want to be a surgeon or what. And my mother said, you know, you're very good with kids. You ought to think about being a pediatrician. So I said, oh, okay. So I put down on as I was in medical school, I was pre-med, and I made a pediatrics, interested in pediatrics. And so when I graduated, I went to University of California, San Francisco, and did my pediatrics there. And then, of course, everybody got drafted then, or you signed up. Well, I signed up. I said, I'll do that for a couple of years. And the thing about signing up ahead of time to be you're in the reserve was that they wouldn't draft you and they let you finish your residency. So I did it, went in the Navy, went to Taipei, Taiwan. And my wife and I spent 2 years in the Orient, had a marvelous time. And we got the curiosity infection while we were there for the world. So we have spent a lot of time every time we had a chance traveling. And then came back to Charlottesville to do anesthesia because I found out that I got a little tired of runny bottoms and runny noses and other things. And at the same time, I had some experience with anesthesia in medical school. And so I decided, let me see what that's all about. At that point, the mortality rate among children from surgery was unbelievable. We wouldn't believe the numbers today, but it was, I think, 1 out of 5,000 or 10,000 died because of the anesthetic. And the reason is, I look back on it, was quite simple. Most of the people doing anesthesia, or everything else, there weren't that many pediatricians who made it a double career. So you didn't have anesthesiologists who were really well trained in neonatal medicine and in young children medicine. And I was very interested in that, so in my residency, and at that point there were very few pediatric anesthesia residencies around. And so I stayed here. I came here at UVA and did it. And I began to look around after my training for a place to go. And I was very fortunate to have as a chairman a gentleman named Doug Eastwood. And he was very, very good and very tolerant. And so I decided to stick around for a while. And I looked at a few programs that were in children's hospitals, but they were so rigid in what they would allow and in the techniques they used. I was surprised. So I went back and told him about that, and he said, well, stick around here for a while, see how you like it. That was 50 years ago.
And you did. How did you like being in the operating room? I mean, you're a pediatrician,
Yeah.
you transition into anesthesia, but it's a whole different world being in the OR, because I'm a surgeon,
Yeah.
and I know it's a different world. How did you like it?
Well, the thing that was obvious to me from the beginning was that this whole thing of surgery is teamwork. And without insulting you, at that time surgeons sort of felt like they were the next step below God. Some of them did. And so it could be a little feisty at times, but I learned real quickly. First of all, I learned that they really needed somebody who could take care of the kid. And I could take care of kids, so that gave me one step up to begin with. And I got along with them very well. I was always a team player. And so, and well, since you're a surgeon, I'm not going to insult anybody with this, but it turns out that I got to be friends with the circulating nurse, with the pre-op nurses, with the recovery room nurses, and we made a team of it. And so people learned how to get along and how to make it go better. And pretty soon surgeons bought into it. And so nobody was really head of the team. It was just a team that they knew their jobs. And so I liked the pre-op area. I liked it if there was a kid who really was a big problem, to take care of them, get them in the operating room, get them through the surgery, and into recovery.
What a great approach.
Yeah, so.
Well, you've been a lot to a lot of people here at the university over the years. Tell me what you're doing today.
Well, I'm 80 now, and 7 years ago, I got an acute cervical disc that really wrecked this hand. As you can see, these two fingers don't hardly work. And you can see I've lost a lot of muscle there and there. And so I couldn't do operating room anymore. And so my chairman said, well, maybe it's time you just retired. You're old enough now. And I was doing a lot of teaching around the U.S. and around the world. I don't know, my wife and I have never counted the places we've been, but we have a room full of pictures. So I was very fortunate. And the reason was because, again, it was the issue of having a pediatric anesthesiologist who was interested in the basic physiology and how to manage a sick child. And that got to be, I was surprised, but I got to Africa and the Netherlands, and then later on Japan and China, and I could go on and on. But, and we loved it.
Medicine opened up a new world for you.
Absolutely.
Well, we appreciate everything you've done for this university, and especially since you're an alumnus of this university. And it's been a great pleasure for me to talk today to Dr. Fritz Berry, and I want to thank you for everything.
Well, thank you.
Pleasure.
I've been very, very lucky.